Hi everyone, my name is Emily Watson and my program proposal is titled Coles County COVID-19 Education Program. Not all of my information will be included since the time is limited, but I hope you have a good understanding of my program by the end of this. Hi everyone, my name is Emily Watson and my program proposal is titled Coles County COVID-19 Education Program. Not all of my information will be included since the time is limited, but I hope you have a good understanding of my program by the end of this. The purpose of the Coronavirus Education Program in Coles County, Illinois is to enhance, educate, and maintain the health of its residents while ultimately decreasing the number of positive cases of coronavirus in Coles County. There was one goal that was identified for this program, and it is to reduce the number of positive cases of COVID-19 among residents of all ages in Coles County. This goal was used to develop the main components of this program, including the objectives and interventions that will be discussed later. There is a specific time frame for this education program, and it would occur over the span of 3 years. Each part is designed to occur at a specific time and in a specific order, the first being conduct searches of the community, and the last is to write an evaluation report. The rationale was developed to describe the need for an education-based program and the importance of hand washing, wearing masks, and it also discussed the number of people it's affected so far, and the health issue profile took into consideration the determinants of health such as policies that would be made. The community profile was made based off the demographics of the people in Coles County as well as Illinois as a whole. Some of the specifics are the total population is 50,621 people, and there have been 26 deaths from COVID-19, and this has since changed since the beginning of the semester. The first objectives are within 6 months prior to the beginning of the program. 70% of the city offices and 60% of the hospitals in the community will receive educational information to display throughout to educate the community on COVID-19. Within the first 3 months of the program, 85% of people will show proper hand washing techniques, and 70% of people in the community will show the proper way to wear a mask while they are out in public. Within 8 months of the program beginning, there will be an increase of 40% in public transportation provided to go to COVID-19 testing centers for those without reliable transportation in the community. By 2021, the budget for COVID-19 information and education will be increased by 20%, and by the year 2022, the program will help to decrease the hospital admissions of positive cases by 50% of COVID-19 of people of all ages in Coles County. Most of the interventions that I made for this program involve creating flyers or educational promotions to display throughout the community, and they would be displayed within stores and offices in the community for easy access. Most of the interventions that I made for this program involve creating flyers or educational promotions to display throughout the community, and they would be displayed within stores and offices in the community for easy access. The first intervention is to create a video that discusses as well as shows the proper hand washing technique. This seems like simple information to understand, but not everyone knows that hands should be washed with warm water and soap for at least 20 seconds for it to be effective. Since there is a public mandate for masks, an intervention would be to analyze the public if they're wearing masks, as well as if the community is following the social distancing protocols in order to help reduce the spread of the virus. An intervention to increase access to testing centers is to make a Facebook page that lists every testing center in the community so members can easily access the information and know where they can go to get tested. The first evaluation method for these objectives and interventions is to conduct a random survey in each of the city offices to evaluate the effectiveness of the informational posters and flyers that we had displayed at the beginning of the program. Another evaluation method is to contact local hospitals for a list of people who have been seen in the offices to evaluate those patients' knowledge and understanding of COVID-19 based off the informational flyers that we had put out. Evaluation by observation is a great method for this program, and going out into the community and observing both how people wash their hands and how they wear a mask would be effective in assessing how educated the community is. Another evaluation method is to make and provide businesses with a questionnaire about if they require their customers to wear masks, as well as a questionnaire about if the people who come into their businesses are wearing masks and if they're wearing them properly. Some of the specific items that went into making a budget for this program were the personnel, the specific office items that would be needed, equipment, among other things. The total budget needed for this program is $194,922.50. That concludes the end of my presentation for my program proposal. Thank you for taking the time to listen to my presentation, and I hope that you can see after the information presented the Coles County COVID-19 education program would be effective for decreasing the number of positive cases.